Table of Contents. 1. Introduction, the blood sugar crisis. 2. The role of minerals in diabetes management. 3. Mineral number 1. Magnesium, the master regulator. 4. Best food sources of magnesium. 5. Scientific research on magnesium and diabetes. 6. Dosage deficiency signs and supplement tips. 7. Mineral number 2. Chromium, the insulin helper. 8. Chromium's role in insulin sensitivity. 9. Chromium-rich foods and natural sources. 10. Dosage, supplement types and safety precautions. 11. Mineral number 3. Zinc, the cellular protector. 12. How zinc supports blood sugar balance. 13. Best food sources of zinc. 14. Zinc deficiency, recommended intake and supplement tips. 15. Bonus section. Other supporting minerals for diabetics. 16. Lifestyle tips to maximize mineral absorption. 17. Final thoughts. Putting it all together. 18. Medical disclaimer and consultation note. 1. Introduction, the blood sugar crisis. Diabetes is more than just high blood sugar. It's a condition that silently affects organs, nerves, and even the immune system. According to the World Health Organization, more than 422 million people worldwide suffer from diabetes. But what if nature gave us tools to better manage it? Among the most powerful tools for blood sugar control are 3 essential minerals. These minerals don't just supplement your diet. They actively help your body regulate glucose levels, support insulin function, and reduce complications. Let's uncover what they are and how they can transform your diabetes management journey. 2. The role of minerals in diabetes management. Minerals are micronutrients that play vital roles in metabolism, enzyme function, hormonal balance, and nerve conduction. For diabetics, certain minerals improve insulin sensitivity, support pancreatic health, regulate blood sugar levels, reduce the risk of nerve damage and oxidative stress. While vitamins often get the spotlight, minerals are the real heroes when it comes to managing diabetes naturally and effectively. 3. Mineral number 1. Magnesium, the master regulator. Magnesium is involved in over 300 biochemical reactions in the body, and many of these are directly linked to blood glucose control. Benefits for diabetics. Improves insulin receptor sensitivity. Helps in glucose transport into cells. Reduces inflammation associated with diabetes. Lowers risk of type 2 diabetes onset. Research shows that people with low magnesium levels have a higher risk of developing insulin resistance and chronic high blood sugar. 4. Best food sources of magnesium. Eating a magnesium-rich diet can significantly help. Leafy greens, spinach, Swiss chard. Nuts and seeds, almonds, pumpkin seeds. Whole grains, brown rice, quinoa. Dark chocolate, 70% and above. Avocados. Legumes, black beans, lentils. These foods not only supply magnesium but also contain fiber, which helps regulate blood sugar. 5. Scientific research on magnesium and diabetes. A landmark study in the journal Diabetes Care found that magnesium intake was inversely associated with diabetes risk. People who consumed the highest magnesium levels had a 33% lower risk of developing type 2 diabetes. Clinical trials have also shown that magnesium supplementation can lower fasting blood sugar and improve insulin response. 6. Dosage deficiency signs and supplement tips. Recommended daily intake. Men, 400 to 420 milligrams. Women, 310 to 320 milligrams. Deficiency signs. Muscle cramps, fatigue, numbness or tingling, poor sleep, high blood sugar despite a healthy diet. Supplementation tips. Use magnesium glycinate or citrate forms for better absorption. Avoid high doses, greater than 500 milligrams, at once. Consult a doctor if on medication. Magnesium can interact with someone. 7. Mineral number 2. Chromium. The insulin helper. Chromium picolinate is often used in diabetes supplements, and for good reason. Chromium is a trace mineral that enhances the action of insulin. Benefits for diabetics. Improves insulin receptor sensitivity. Helps lower fasting blood sugar. Reduces HbA1c levels. Decreases cholesterol and triglycerides. 8. Chromium's role in insulin sensitivity. Chromium is believed to potentiate the action of insulin by helping it bind more effectively to its receptors on cell membranes. Without sufficient chromium, the body struggles to regulate glucose efficiently. 9. Chromium-rich foods and natural sources. Although only needed in small amounts, food sources include broccoli, whole wheat bread, green beans, grapes and apples, potatoes, garlic, lean meats and eggs. 10. Dosage, supplement types and safety precautions. Recommended daily intake. Adults, 25 to 35 micrograms. Supplement form. Chromium picolinate is widely studied and easily absorbed. Safety. Avoid excessive intake. Monitor blood sugar closely when supplementing. 11. Mineral number 3. Zinc. The cellular protector. Zinc is not just an immune booster. It plays a direct role in insulin production, glucose metabolism, and pancreatic health. Key benefits. Supports beta cells in the pancreas. Reduces oxidative stress. Helps with wound healing, critical for diabetics. May reduce risk of diabetic complications. Neuropathy, vision loss. 12. How zinc supports blood sugar balance. Zinc participates in the synthesis, storage, and secretion of insulin. Diabetics often have lower zinc levels due to increased excretion in urine. 13. Best food sources of zinc. Oysters, richest source. Red meat and poultry. Pumpkin seeds. Chickpeas. Cashews. Yogurt. Including these in your diet can naturally boost your zinc intake. 14. Zinc deficiency, recommended intake and supplement tips. Recommended daily intake. Men, 11 milligrams. Women, 8 milligrams. Signs of zinc deficiency. Slow wound healing. Loss of appetite. Frequent infections. Hair loss. Skin issues. Supplementation tips. Take zinc gluconate or zinc citrate. Avoid taking with iron or calcium. 15. Bonus section. Other supporting minerals for diabetics. While magnesium, chromium, and zinc are the top 3, others also support blood sugar regulation. Vanadium helps mimic insulin's action at the cellular level. Selenium protects the pancreas and may support thyroid function in diabetics. Potassium supports heart health and nerve function, often needed when taking diuretics. 16. Lifestyle tips to maximize mineral absorption. Eat minerals with food for better absorption. Avoid excessive alcohol and caffeine, which deplete minerals. Limit high sugar and processed foods, which interfere with absorption. Include healthy fats to improve nutrient uptake. Stay hydrated. Dehydration affects mineral transport. 17. Final thoughts. Putting it all together. Controlling diabetes naturally is not about restriction. It's about nourishment. By ensuring your body has the right minerals, you're supporting the very systems that control blood sugar. Here's a recap. White heavy check mark magnesium for glucose regulation and insulin sensitivity. White heavy check mark chromium for boosting insulin effectiveness. White heavy check mark zinc for supporting the pancreas and cell health. Combined with a healthy diet, regular movement, and mindful stress reduction, these minerals form a powerful trio for diabetics aiming to take control of their health naturally. 18. Medical disclaimer and consultation note. This article is for educational purposes only and is not a substitute for professional medical advice. Always consult your healthcare provider before starting any supplement or changing your diet, especially if you have a health condition or are on medication.